Hi guys, it is Kiara and I am back with another video. Let's get started. Alrighty guys, so if you have not watched any of my videos, if you have not been on my channel before, let me go ahead and reintroduce myself. My name is Kiara. I am currently in pharmacy school, guys, pharmacy school. And thank God I have made it through the past 3 years. So I am going into my 4th year of pharmacy school. So I kind of want to, how do I say, inform you guys how pharmacy school goes for those who are interested in pharmacy school, or you're watching this video and you just don't know. So for pharmacy school, it is a 4-year program. Pretty much all over it's 4 years. There are programs that are like dual programs, so it may be like a 6-year program where you do your PharmD as well as possibly get your MBA. I didn't even know anything about that. The school I just chose it because it was close to the house. I chose it because I knew it was a smaller class size. It was more so one-on-one. So when you're looking at the pharmacy school, make sure those are things that you're also looking at. There are programs that are accelerated pharmacy programs where instead of taking the program for 4 years and you have your summer breaks, there are programs that are just 3 years and you really don't get any breaks. You're just year-round with school. So if you're interested in pharmacy school, those are things that you want to look into. So back to myself in terms of me and taking a 4-year program pharmacy school. The first 3 years of pharmacy school is pretty much just book work. I think I kind of explained this in my other channels too, but I'm summing it all up here. The first 3 years is book work. Book work as in you're being taught in the classroom, you go over lectures, you have books to study from, and constantly on a weekly basis you have 2 to 3 exams every single week, the entire semester, every single semester, and it doesn't stop. So that's what the 3 years it's for. You're supposed to learn all of the basics, the therapeutic areas that you are supposed to learn. Now your 4th year, which is what I am right now, going into my 4th year, that's where you only do rotation. So there is no more of me going back into the classroom, listening to professors speak, talk, and teach a lecture. There is no more of that. There is no more of me really going to the school. At this point, I will be going on rotation. So let me back up just a little bit. The 3 years while you are in the classroom, you're being taught lectures and therapeutic areas. Besides the book work, you are also, it's included in the program. In order for it to be an accredited program, you are supposed to go on rotations. And these rotations are called IPPEs. So it's IPPE. And that stands for Introductory Pharmacy Practice Experience. Sorry, I forgot it. So Introductory Pharmacy Practice Experience. That's what those are. And it's included within the program depending on how your school breaks it down. But it's kind of like in a fall semester, we had to do like 2 weeks straight. In our spring semester, we had to do like once every Friday. So it depends on how your school makes it. But these are basically rotations that you have to do while in pharmacy school, and they're called introductory. So for example, introductory meaning these are very for example, like Walgreens or CVS, you'll have to do a rotation there. So you're not getting paid, it's a rotation. So for the rotation, it's included in your school schedule. Again, you are working for free, but it's a learning experience. That's why it's called a practice experience. So you're going there, you're kind of getting your feet wet. If you've never worked in a pharmacy before, this is your chance while in pharmacy school to get your feet wet. And you have to do it. It's not something that you choose to. Again, it has to be within the accredited pharmacy program. Where you have to take these introductory courses. So that's what happens throughout your 3 years of being in pharmacy school while still taking those exams and those classes. Your IPPEs, which is what we call IPPEs, the IPPEs, it varies. Like sometimes they may want you to do, most of the time it is retail, but sometimes, for example, like we had a rotation that was hospice. After that, you're able to actually go into the hospital. Now, because you are still a student, you're not doing too much with the doctors, like going on rotations and things. You don't do that. For the IPPE rotation, when you're in the hospital, you're really just kind of, again, getting your feet wet. You know, you kind of get to shadow the pharmacist. You kind of get to do a little projects, but nothing crazy and nothing major. The major stuff comes now, which is, for me, your 4th year, which is your APPEs. And APPEs is APPE, and that stands for Advanced Pharmacy Practice Experience. And again, your APPEs is what takes place as you start your P4 year. So for the rest of this year, all the way until May of 2024, I will be on my APPEs, and it is Advanced Practice Experience. So every school is different. For mine, so they break it down into a 6-week rotation. So every 6 weeks, I will be doing something different. I will be doing a different specialty of pharmacy, depending on what I chose and what I selected. That's what I will be doing. And I'm nervous, really nervous, but I'm really excited, because it's kind of like throughout these past 3 years of the exams and the stress and learning all that I have learned, it's time to use what I have learned in the actual real workplace. And I think what makes me nervous is that you have preceptors, which are the people that's overseeing you while you're in your rotation. You know, some of them can be nice and chill, and some of them can be very mean and intimidating. So it's kind of like, you know, you don't know what you're walking into. Each rotation is different. You know, every place is different. They have their own guidelines of how they run. So it will be a lot to take in when I actually, you know, start doing the different rotations. But I'm excited at the same time, because it's like, wow, like I can't believe I'm here. I can't believe I've made it to the 4th year. Like, if you guys see my video before, it was about P2 year. I was crying and I was like, I don't know how I'm gonna make it, and people are dropping out. And look at me now. Look at me now. Yeah, I know I'm a little cuckoo. But I'm here. Like, I'm here. Oh my God, I'm here. It's happening, you guys. It's happening. It's happening. It's happening. So again, I will be starting my APPEs. Our APPEs for our school, we start in June. Again, it's every 6 weeks. So basically all the way up until it's time for graduation in May, I'll be going on different rotations in different sites. So let me tell you what I will be doing. My first rotation is Astellas Pharmaceutical Company, because I really want to go into the pharmaceutical industry. So I'm super excited about that. My second one is an institutional hospital. I'm not going to say where that is, too much information. My third one, it has to be retail. So that would be like Walgreens, CVS, or Jewels. That would be your community one. My fourth one, that would be at Trinity Advocate Hospital. Yay. That would be my medicine rotation. My fifth rotation would be in Florida, guys. I decided to be a big girl and go move away for 6 weeks and be on my own to Florida. But I'm interested in antipsychotic medications because of one of my family members. So I'm going to go to Florida and focus on psychiatric medicine, specialty for pharmacists. And then lastly, I have ambulatory care, which will be back here in Chicago, with one of my favorite mentors. She knows I like to teach, so I know she's also going to have me teaching, which is good. I'm going to get my feet wet in all these different areas. And then lastly, our school took one of our rotations away for a good reason, because again, not thinking about NAPLEX scores when I wanted to do pharmacy school. I just wanted to do pharmacy school. My school does not have the top of the line NAPLEX scores, and that is basically the exam that you take to be certified as an actual pharmacist. And what I hear is that it's hard, and my school apparently doesn't do well with taking it. So instead of having another rotation to go to another site, that last rotation, pretty much the last rotation is for you to come to the school and study. study your butt off. That's what the last one is, to prepare for that final exam. So I'm grateful for that. I'll actually have time, you know, to be able to study at the end. But I also know that while I'm on my rotations, I have to still study on a daily basis so that, you know, I don't forget things. You know, like, this is my career. Like, I chose this for reasons, what I want to do. I can't just stop, you know, because I don't have any exams that they're actually testing me on. No, like, I need to know my stuff when it comes to these patients. So that really just sums up my video. I really just wanted you guys to see, like, hey, I made it this far. I wanted you guys to kind of, you know, learn something about pharmacy school. You have introductory rotations and you have advanced rotations, which are required under your accredited pharmacy program. You have to have so many hours of experience within your program, and these are things that have to be done within your program. So you kind of get to see, like, I've done some before. I'm doing my advanced ones right now. That goes for any pharmacy school. Once it's your last year, it is considered your APPEs, your advanced pharmacy practice experience. So I'm gonna go ahead and close out this video. If you have any questions, have any comments, drop them down below. And you know, let me know how you guys are feeling, you know, about my vlogs. You know, what information do you guys want to know? Like, I think I have a little bit more free time now where I can kind of make more content and, you know, like, educate you guys about pharmacy school. So I appreciate you guys for watching this video. I love you guys as always for supporting me and watching my videos, and I love you. Peace.